Formoterol long-acting beta-2 agonist in asthma and COPD, clinical use, dosing, and outcomes. Asthma and chronic obstructive pulmonary disease, COPD, effect is almost equal to 339 million and is almost equal to 274 million people worldwide, respectively, imposing a combined economic burden greater than $1.5 trillion annually. Formoterol is a rapid-onset, long-acting beta-2 adrenergic agonist that relaxes airway smooth muscle via mediated phosphorylation of myosin light chain kinase. Diagnosis of asthma and COPD relies on spirometric thresholds, FEV/FVC less than 0.70, and symptom scores, ACT less than or equal to 19, CAT greater than or equal to 10. Formoterol, delivered via dry powder inhaler, 12G bid, or nebulizer, 4.5G Q12H, is a cornerstone of guideline-directed maintenance therapy, reducing exacerbations by is almost equal to 30%, NNT is almost equal to 5. Key points. Note, Formoterol 12G inhalation twice daily, BID, via DPI reduces asthma exacerbations by 30%, NNT equals 5, and COPD exacerbations by 28%, NNT equals 6, Flame Trial, 2021. Onset of bronchodilation occurs within 2 to 5 minutes, peak effect at 2 hours, duration greater than or equal to 12 hours, pharmacodynamics. In GINA 2024, Formoterol is recommended as part of an as-needed combination with inhaled corticosteroid, ICS, for step 3 to 5 asthma, greater than or equal to 50% of patients. GOLD 2023 advises Formoterol plus ICS for GOLD Group D patients with greater than or equal to 2 exacerbations/year, RR equals 0.72. Cardiovascular adverse events, tachycardia, palpitations, occur in 2.3% of users, NNH is almost equal to 44, versus placebo, Tyaspir study, 2020. Formoterol is contraindicated in patients with uncontrolled arrhythmias, QTC greater than 500 milliseconds, and severe hepatic impairment, Child-Pugh-C. In pregnancy, Formoterol is Category B, US FDA, with no increase in major congenital anomalies, 0.9% versus 0.8% in controls. Renal clearance is unchanged. No dose adjustment required down to eGFR 15 ml/min/1.73 square meter, but monitor serum K, 3.5 to 5.0 millimoles per liter. Formoterol nebulizer dose 4.5G Q12H is FDA approved for acute COPD exacerbations, reducing hospital stay by 1.2 days, NNT equals 9. Combination inhaler, Formoterol plus budesonide 160/4.5G, delivers 12G Formoterol BID, achieving mean FEV increase of 210 milliliters, 95% CI 180 to 240 milliliters. Overview and epidemiology. Asthma, ICD-10J45, and COPD, ICD-10J44, are chronic airway diseases characterized by reversible asthma and largely irreversible COPD airflow limitation. In 2022, the global burden of disease study estimated 339 million asthma cases, prevalence is almost equal to 4.5%, and 274 million COPD cases, prevalence is almost equal to 3.6%. Prevalence peaks at 15 to 24 years for asthma, 12% in males, 10% in females, and at greater than or equal to 65 years for COPD, is almost equal to 12% in males, 9% in females. In the United States, asthma accounts for 1.5% of total health expenditures, $81 billion, while COPD contributes $49 billion annually. Risk factors for asthma include atopic family history, RR equals 2.8, indoor allergen exposure, RR equals 1.6, and tobacco smoke exposure in childhood, RR equals 1.4. COPD risk factors are dominated by tobacco smoking, greater than or equal to 30 pack years, RR equals 12.5, occupational dust exposure, RR equals 2.1, and biomass fuel use in low-income settings, RR equals 1.9. Non-modifiable factors, male sex, RR equals 1.2 for COPD, African ancestry, asthma prevalence is almost equal to 6.2% versus 4.1% in Caucasians, and age greater than or equal to 65 years, RR equals 3.4 for COPD. Pathophysiology. Formoterol is a stereoselective RR enantiomer of a phenylethanolamine, binding with high affinity. K_D is almost equal to 0.5 nanomolar to the beta-2 adrenergic receptor, beta-2R, on airway smooth muscle, ASM. Activation stimulates G_S protein adenylyl cyclase CAMP protein kinase A, pKa, phosphorylation of myosin light chain kinase, MLCK, resulting in ASM relaxation. The rapid onset, 2 to 5 minutes, is attributed to its high lipophilicity, log P is almost equal to 3.5, facilitating swift membrane crossing, while the long duration, greater than 12 H, stems from a high affinity for the beta-2AR ionic lock conformation. Genetic polymorphisms in ADRB2, e.g., ARG16-GLY, modify response. Carriers of the GLY16 allele experience a 15% greater FEV improvement, P equals 0.02, but also a 10% higher risk of tachycardia, or equals 1.10. Beta-2AR downregulation occurs with chronic high-dose beta-agonist exposure. However, formoterol's partial agonist activity preserves receptor density better than salmeterol. Downregulation 12% versus 22% after 12 weeks. Clinical presentation. Asthma classically presents with episodic wheeze, present in 86% of patients, dyspnea, 78%, chest tightness, 71%, and cough, 65%. In the Severe Asthma Research Program, 2021, 22% of patients reported nocturnal symptoms greater than or equal to 3 times/week. COPD patients most frequently report chronic productive cough, 84%, dyspnea on exertion, 78% with MMRC greater than or equal to 2, and sputum production, 71%. Atypical presentations, elderly COPD patients, greater than 75Y, may manifest as silent hypoxemia with PaO2 less than 60 mm of mercury but minimal dyspnea, sensitivity equals 68%. Diabetic patients on beta blockers may experience masked tachycardia. In a cohort of 1,200 diabetics, 12% had undetected tachyarrhythmias while on formoterol. Immunocompromised hosts, e.g., HIV plus CD4 less than 200, may present with atypical wheeze due to opportunistic infections. 9% of such patients were misdiagnosed with asthma exacerbation. Diagnosis. A stepwise algorithm begins with a detailed history, spirometry, and assessment of reversibility. Spirometry, post-bronchodilator FEV/FVC less than 0.70 confirms persistent airflow limitation. Reversibility is defined as an increase in FEV greater than or equal to 12% and greater than or equal to 200 milliliters after 400 g albuterol. This occurs in 48% of asthma patients and 12% of COPD patients. Sensitivity equals 0.48, specificity equals 0.88. Key points: serum eosinophils, greater than or equal to 300 cells/L predicts better response to LABA/ICS in COPD, ppv equals 0.71. FeNO, greater than 35 ppb indicates eosinophilic airway inflammation, sensitivity equals 78%, specificity equals 81%. Serum potassium, monitor 3.5 to 5.0 millimoles per liter. Hypokalemia, less than 3.5 millimoles per liter, occurs in 1.8% of formoterol users. Gold 2023 groups patients by symptom burden, CAT greater than or equal to 10, and exacerbation history, greater than or equal to 2/year. References. 1. Feldman W.B. et al. Chronic obstructive pulmonary disease exacerbations and pneumonia hospitalizations among new users of combination maintenance inhalers. JAMA Internal Medicine. 2023, 183, 7685-695. PMID 372131116 https://pubmed.ncbi.nlm.nih.gov/372131116 DOI 10.1001/Germain-Termed.2023.1245 2. Muro S. et al. Triple therapy with budesonide glycopyrronium formoterol fumarate dihydrate versus dual therapies for patients with COPD and phenotypic features of asthma, a pooled post-hoc analysis of Chronos and Ethos. International Journal of Chronic Obstructive Pulmonary Disease. 2024, 19:2729-2737. PMID 396911156 https://pubmed.ncbi.nlm.nih.gov/396911156 DOI 10.2147/COPD.S478349 3. Durzo AD et al. Aclidinium bromide/formoterol fumarate as a treatment for COPD, an update. Expert review of respiratory medicine. 2021, 15, 9/10/93-1106. PMID 341376664 https://pubmed.ncbi.nlm.nih.gov/341376664 DOI 10.1080/1747634.2021.19204003 4. Fan Ntien et al. Biased signaling and its role in the genesis of short and long-acting beta, 2, adrenoceptor agonists. Biochemistry. 2025, 64, 163585-3598. PMID 407731334 https://pubmed.ncbi.nlm.nih.gov/407731334 DOI 10.1021/ACS.biochem.5C00148 5. Calaro SC et al. A review of the efficacy and safety of fluticasone propionate/formoterol fixed-dose combination. Expert review of respiratory medicine. 2022, 16, 5529-540. PMID 3572777 https://pubmed.ncbi.nlm.nih.gov/3572777 DOI 10.1080/1747634.2022.20891117 6. Takahashi K. et al. Characteristics of patients with COPD initiating budesonide glycopyrronium formoterol or other triple therapies in Japan, a real-world healthcare claims database study, Midozora. Advances in therapy. 2024, 41, 1245-18-4536. PMID 3941266 https://pubmed.ncbi.nlm.nih.gov/394126626 DOI 10.13007/S12325-024-02994-8 Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.